There was never a perfect answer when it comes to the COVID-19 vaccine rollout. And while Connecticut remains one of the best vaccinators in the nation, some communities feel like they are being left behind.
These two groups are just really essential pieces of the puzzle that should not be left out.
Shannon Hayslip is referring to medically high-risk individuals and essential workers. She herself has spent the last year almost exclusively in isolation after a breast cancer diagnosis.
People in my position are experiencing extreme anxiety about going out in public, meeting all of our obligations and our doctor's appointments.
Hayslip would fall into the last group of people to be vaccinated under the state's age-based vaccination plan. The governor says he chose the plan since other scenarios proved overly complex and would potentially increase vaccine distribution inequalities.
Once you start making exceptions, it gets really complicated. And more importantly, in 3 weeks, we keep opening the aperture.
Even while that aperture opens, communities of color are seeing vaccinations at a lesser rate. A community discussion on the matter hosted by our partner CT and Vivo tried to break some of the stigma around the vaccine.
The facts is going to be the antidote for these issues.
The panel discussed many of the trust issues that people in the community are feeling. They point to historical mistreatment of African Americans when it comes to vaccines and people finding false information on social media.
What people need to understand, no matter the color, is that the same vaccine that our Caucasian brothers and sisters are taking is the same vaccine that anyone else, any other American in this country is going to take.
Under the current plan, the governor says that by April, 90% of Connecticut will have access to get their first dose of the vaccine. And as of now, there appears to be no changes coming to that plan. Dave Puglisi, Fox 61 News.